Hello, this is Dr. David Bilstrom from the International Autoimmune Institute at Brigham Memorial Hospital. Our next installment will have to do with vitamin D. You might think that you know everything already about how important vitamin D, but as it turns out, we're finding out every day how much more important it is than we ever could have imagined. Now, vitamin D is a major immunomodulator. It regulates the immune system. So when vitamin D is lower than ideal, not only do people have a much higher chance of getting all the autoimmune diseases, but also the downregulated immune system issues like cancer. Low vitamin D has also been shown to increase risk of heart attack, stroke, diabetes, Alzheimer's, osteoporosis, etc. It'll have a profound impact on the system as a whole because it has such a profound impact on the gut. Dr. Zhang and his colleagues at Rush University in Chicago have done some beautiful research on vitamin D and vitamin D receptors in the gut. What they found is when the vitamin D receptors are not optimally stimulated by vitamin D, we get intestinal permeability disorders or leaky gut. And as you know from previous installments, that leaky gut is a big driver of autoimmune disease, chronic disease in general, and inflammation throughout the body. Research has also shown that when the gut, the colon, is inflamed or irritated, colitis, ideally you'd like to have probiotics have a profound impact on reversing that process. What they found is that if the vitamin D receptors in the gut are not optimally activated by the vitamin D levels, then probiotics will not have a chance to actually reverse the colitis. To give you an idea of the profound impact on the immune system, let's talk about breast cancer risk and vitamin D. A lovely study was done that divided women into 3 different groups of vitamin D levels: the low, the mid, and the high. What they found was that the women in the high vitamin D level group, 53 or above, had over a 50% less chance of ever developing breast cancer than the women in the lowest group. Studies have shown that for every 30 points your vitamin D level goes up, you cut your chance of ever getting cancer in your lifetime by 25%. So let's say somebody is at a 20, which in some labs might be just at the low end of the range, but we want people up optimally to be 70 to 80, though some people say 80 to 90. So let's say you take your vitamin D level from a 20 and you bring it up to an 80, 60 points higher. That should give you a 50% less chance of ever developing a cancer in your lifetime. That's a profound impact on the body. Just a couple weeks ago, a lovely study came out looking at vitamin D levels in newborns and multiple sclerosis risk. What they found was that in the group that had the highest vitamin D levels, which in this study were 50 and above, so right there you see there might even have been more chance for positive impact if they got to the ideal levels of around 70 to 80. But in the group that was 50 or more compared to the group that was at the low end, the newborns had over a 50% chance of developing multiple sclerosis compared to the children that were in the highest vitamin D level. As you saw in previous installments, starting to prevent autoimmune disease should start in parents before they have their children. If not then during the pregnancy. If not then as a child. And if not then as an adolescent or young adult. But the earlier you start the preventative medicine, ideally fixing the genes before the genes are even passed on, but making sure that you optimally control everything that will drive autoimmune disease during conception and thereafter, it can have a profound impact on preventing the autoimmune disease. Now, ideally, everybody would like to perform at their highest levels. Whether you're a child, an adult, if your age has gotten to where that you're actually thinking you're elderly. They've done some lovely research on vitamin D and sports performance. How can you optimally perform in sports? Now, this also goes for people outside of sports because everybody wants to be able to perform at their optimal levels, whether you're a child, an adult, or you're getting on in the years. A good example of how profound the impact of vitamin D is on performance in general is in sports. Now, years ago, they started to see that East German and Russian athletes were performing at a much higher level than athletes from the West. The thought initially was that it was all based on steroid use. But what had actually happened is that they started figuring out that vitamin D had an impact on athletic performance. Initially, they saw that the East German and the Russian athletes were not performing as well in the winter as the summer. And they were wondering if this is because of training indoors versus outdoors. So they wanted to look a little more closely at this. What it turned out was the athletes' performance started to go down around mid-September when they were still training outdoors. This is when the sun starts to go south. What they saw was that the athletes' vitamin D levels were starting to go down as the sun started traveling south. So they supplemented with vitamin D, got their levels to optimal levels, and started to see a profound impact on sports performance. Well, word started getting out after a while, and researchers in Chicago wondered if this same vitamin D sports performance connection occurred in Chicago athletes, given that Chicago was at about the same latitude as where the East Germans and the Russians were training. So what they did, and they published a study in 1978, was they got a large group of high-level athletes in the Chicago area to come to the University of Illinois and offer them a training program specifically for high-level athletes. Now, they checked everybody's vitamin D levels, and everybody did the training program, but half of the athletes had their vitamin D levels optimized to a level of 70 or above. What they saw in the athletes that did not have their vitamin D optimized, but just did the training program, they saw about a 3% improvement in athletic performance. So for these high-level athletes, if they can get a 3% advantage on their competition, that can have a profound impact on their results. So for example, a cross-country runner, the difference between first and eighth might be that 3%. What they saw in the athletes that had their vitamin D optimized and had the athletic performance training, they saw a 20% improvement in athletic performance. So they went from a 3% to a 20% improvement with optimizing vitamin D levels. Now, they thought that was quite profound. What studies have also shown is that if your vitamin D levels are optimized and you're an athlete, you do not tend to get injured as much. If you do get injured, the injury does not tend to affect your play as much. If the injury does affect your play, it does not tend to affect it for the rest of the season. And if you are injured, it does not tend to be a career-ending injury. Everybody can have their performance optimized, whether it has to do with the immune system or your health in general. Now, in our next installment, we're going to be talking more about thyroid. Thyroid's called the great mimicker, because when thyroid's off, it can look like about anything. Now, one reason they think vitamin D has such a profound impact on the body is that if you're going to get thyroid hormone into the cells so it can do its work optimally, you have to have a vitamin D level of at least 70 to get the thyroid inside. Now, what does thyroid when it's low cause? We put together the signs and symptoms of low thyroid, and you'll see that the things that can happen when thyroid is low, 2 pages. I'm just going to give you a short excerpt of what it can cause. Depression, weight gain, constipation, headaches, migraine headaches, brittle nails, rough skin, menstrual irregularities, fluid retention, poor circulation, nails that are easily broken, panic attacks, anxiety, decreased memory, inability to concentrate, joint pain, muscle pain. You get the idea. Remember, the body's always ready to heal. You just have to give it a chance.